Access to clean water is a fundamental human right, yet nearly 2.2 billion people worldwide lack access to safe drinking water. This lack of access has devastating consequences for public health, particularly in low-income countries where waterborne illnesses are a leading cause of death. Contaminated water can cause a range of diseases, from cholera and typhoid to diarrhea and dysentery. These diseases can lead to dehydration, malnutrition, and even death, particularly in children and those with weakened immune systems. According to the World Health Organization, WHO, waterborne illnesses kill an estimated 485,000 people each year, with children under the age of 5 accounting for more than half of these deaths. The consequences of unsafe water are not limited to developing countries. In the United States, for example, an estimated 15 million households rely on private wells for drinking water, and many of these wells are contaminated with pollutants like nitrates, arsenic, and bacteria. These pollutants can cause a range of health problems, from gastrointestinal issues to cancer. In addition to causing direct harm to human health, contaminated water can also have indirect effects on public health. For example, when people become sick with waterborne illnesses, they may miss work or school, reducing their productivity and economic opportunities. In addition, communities that lack access to safe drinking water may be forced to spend time and resources collecting water from distant sources, which can further exacerbate poverty and inequality. One of the key challenges in ensuring access to clean water is the issue of water scarcity. According to the United Nations, more than 2 billion people live in countries experiencing high water stress, and this number is expected to rise as populations grow and climate change exacerbates drought and water scarcity. As water becomes scarcer, there is a risk that conflicts may arise over access to this vital resource, further exacerbating public health risks. To address the issue of water scarcity, it's important to invest in sustainable water management practices like water harvesting, conservation, and reuse. For example, rainwater harvesting can help to capture and store water for use during dry periods, while wastewater treatment and reuse can help to reduce demand for freshwater resources. By adopting these and other sustainable water management practices, we can help to ensure that water resources are used wisely and efficiently, reducing the risk of water scarcity and improving public health. To address the issue of water pollution, it's important to adopt a polluter pays approach, where those responsible for water pollution are held accountable for cleaning up and mitigating the damage caused. This can include measures like pollution taxes, fines and regulations, as well as incentives for businesses and individuals to adopt more sustainable practices. In addition, efforts to reduce plastic waste and improve waste management can help to prevent plastic pollution from entering water sources. On World Water Day, it's important to recognize the link between clean water and public health, and to advocate for sustainable management of water resources. By ensuring access to safe drinking water, addressing issues like water scarcity and pollution, and investing in sustainable water management practices, we can help to improve the health and well-being of communities around the world.